Hi students, I'm Praveen Sebastian Paul. In this lecture, we are discussing the distribution, suicide, controversies, and public service announcements in organ transplantation. When it comes to the distribution, in India, there are 6 types of life-saving organs that can be donated to save the life of a patient. These includes kidneys, liver, heart, lung, pancreas, and intestine. Of late, uterus transplantation has also been started in India. However, the uterus is not a life-saving organ as per the Transplantation of Human Organ Act (THO Act) of 2011. Recently, a scoring system known as Seth Donation of Organ and Tissues (S.Score) has been developed to assess the hospital for best practices in tissue donation and organ donation after brain death. The United Network for Organ Sharing and Organ Procurement and Transplant Network regulate the organ procurement organization with regard to the organ distribution, organ procurement, with regard to the procurement and distribution ethics and standards. OPS are the non-profit organizations charged with the evaluation, procurement, and allocation of organs within their designated service areas. Once a donor has been evaluated and consent obtained, Provisional Allocation of organ commences. The UNO developed a computer program that automatically generates donor-specific match list for suitable recipients based on criteria that the patient was listed with. The locations of a transplant center with respect to a donor hospital is given priority due to the effects of cold ischemic times (CIT). Once the organ is removed from the donor, blood no longer perfuses through the vessels and begins to starve the cell of oxygen. This condition is known as ischemia. Each organ tolerates different ischemia times. Heart and lungs need to be transplanted within 4 to 6 hours from recovery. Liver is about 8 to 10 hours and pancreas are about 15 hours. Kidneys are the most resilient to ischemia. Kidneys packed on ice can be successfully transplanted 24 to 36 hours after recovery. Developments in kidney preservation have yielded a device that pumps cold preservation solution through kidney vessels to prevent delayed graft function (DGF) due to ischemia. Perfusion devices, often called kidney pumps, can extend graft survival to 36 to 48 hours post-recovery for kidneys. Recently, similar devices has been developed for the heart and lungs in an effort to increase distances procurement team may travel to recover an organ. The next point to be discussed is suicide. People committing suicide have a higher rate of donating organ than average. One reason is lower negative response or refusal rate by the family and relatives, but the explanation for this remains to be clarified. In addition, donation consent is higher than average from people committing suicides. Attempted suicide is a common case of brain death, mainly among young men. Organ donation is more common in this group compared to other causes of death. Brain death may result in legal death, but still with the heart beating and with mechanical ventilation, all other vital organs may be kept completely alive and functional, providing optimal opportunities for organ transplantation. There are different controversies in organ transplantation. In 2008, California transplant surgeon Houghton Roosrock has charged with dependent adult abuse for prescribing what prosecutors alleged were excessive dose of morphine and sedatives to hasten the death of a man with adrenal leukodystrophy and irreversible brain damage in order to procure his organ for transplant. The case brought against Roosrock was the first criminal case against a transplant surgeon in the United States and resulted in his acquittal. Further, Dr. Roosrock successfully sued for defamation stemming from the incident. At California Emmanuel Medical Center, neurologist Narges Pazauki said an organ procurement organization representative pressed her to declare a patient brain dead before the appropriate test has been done. In September 1999, eBay blocked an auction for one functional human kidney, which had reached a highest bid of $5.7 million US. On June 27, 2008, Indonesian Sulaiman Damanik, of age 26, pleaded guilty in a Singapore court for sale of his kidney to CK Tang's executive chair, Mr. Tang Wee Sung, 55 years, for 150 million rupee, that is equivalent to 17,000 US, and the Transplant Ethic Committee must approve living donor kidney transplants. Organ trading is banned in Singapore and in many other countries to prevent the exploitation of poor and socially disadvantaged donors who are unable to make informed choices and suffer potential medical risk. When it comes to the public service announcements, marketing for organ donation must walk a fine line between stressing the need for organ donation and not being too forceful. If the marketing agent is too forceful, then the target of the message was reacted defensively to the request. According to the psychological reactant theory, a person will perceive their freedom threatened and will react to restore that freedom. The awareness about organ donation led to great social support for organ donation, in turn leading to greater registration. By starting with promoting college students' awareness in organ donation and moving to increasing social support for organ donation, the more likely people will be registered as organ donors. So my dear students, these are the major points to be discussed in the terms of distribution, suicide, controversies and public service announcement in organ transplantation. So my dear students, kindly go through this assignment question. The question is, write notes on distribution, suicide, controversies and public service announcements in organ transplantation. So dear students, in the upcoming lecture we will discuss the legislation and global perspectives in organ transplantation. So see you soon. Until then, goodbye. Thank you and all the best.